The mission of the Gianna Center is to provide pro-life, authentically Catholic, reproductive health care for women. So we do primary care for women, gynecologic care for women, Pap tests, annual exams, we do STD testing, we offer pro-life prenatal care, and an amazing treatment for infertility and recurrent miscarriage. Using something called the Creighton model system, women are able to identify subtle changes in their body that occur over the course of their monthly cycle that allow them to understand what's going on, use that information for family planning, use that information to maintain their health, and also identify when problems arise. The women's fertility cycle is fascinating, and actually women love learning about what's going on inside of their body. And what I see happening as I'm teaching the woman about her fertility, it's like a light goes on. All of a sudden, things that she's experienced for her whole life, but never understood, never knew if they were normal, make sense to her. So we know every month an egg develops, and as it does, her body begins making a hormone called estrogen, which causes detectable changes. After she ovulates, her body makes a different hormone, progesterone, that plays a really important role in preparing her body to receive and sustain a pregnancy. With the Creighton model system, women learn to identify when they're fertile, and if they're trying to avoid a pregnancy, they avoid having intercourse during that time. If they're trying to conceive, then they use the system the opposite way and they target the fertile days for intercourse. In fact, one of the studies done on family planning looked at 1,800 couples over 13,000 months, had a 99.5% effectiveness rate when used to avoid pregnancy, which is comparable to any other form of birth control that a woman can use. When used to achieve a pregnancy, 75% of couples will conceive the first month that they target the fertile time, 90% by 3 months, and 98% by 6 months. And so for us, a couple who's been targeting the fertile time for 6 months, if they haven't conceived, that's a sign that we should start to look into an underlying fertility problem. Infertility is one of the most painful things that a couple can experience, and the majority of couples go to a fertility specialist seeking help, looking for a diagnosis and hoping for a child. Unfortunately, often very little is done to make a diagnosis, and couples are very quickly told that invasive procedures like in vitro fertilization or intrauterine insemination are their only hope. But the reality is that infertility is a symptom of something. There is a reason that a couple is not conceiving, and in most cases, if you can identify what that reason is, it can be corrected, and a couple absolutely can conceive through natural intercourse. What happened in the field of infertility in the late 1970s, doctors came up with this procedure, in vitro fertilization, where you could remove the egg and the sperm, combine them, and put them back in. And early success rates were very low, 10 to 15%. But everybody believed that this was going to revolutionize the treatment of infertility. And so over the past 30 to 40 years, all of the focus of research has been on trying to perfect the IVF technique. For women who are between 35 and 40, the chance of conceiving through IVF is only about a 30 to 40% chance. After 40, that rate drops to 10% per cycle. At the Gianna Center, we are relying on research done over the same past 40 years that has an entirely different focus. NAPRO technology stands for Natural Procreative Technology and has as its primary focus working cooperatively with the natural menstrual cycle. So we use the Creighton model system chart, the woman's record of the signs of her fertility, as a diagnostic tool. Just by looking at her chart, abnormal patterns show up. There are cases where we can predict that a woman will be at risk of miscarrying and prevent it before it happens. Once we've looked at the patterns in her chart, we then use her chart to do a very targeted assessment of her hormones. In that way, we are able to identify subtle signs of things that can be corrected. The NAPRO technology approach usually starts with a consultation. We're going to sit down with the couple, usually for about an hour, and find out what symptoms and signs she's already having that give us clues about what may be keeping her from conceiving. We then teach her to monitor her cycles using the Creighton model system. After that, we do a detailed hormonal analysis of her menstrual cycle to detect subtle hormonal abnormalities that are usually correctable and definitely can be keeping her from conceiving. We also look closely at the way she ovulates. And there are actually several abnormal patterns of ovulation, usually missed, that are correctable. We do that with a series of ultrasounds timed to the natural cycle. The third major piece of the NAPRO technology evaluation is actually surgical. Now, not everybody needs surgery, but in many cases, the underlying cause of a couple's fertility can be corrected and cured. One of the very first patients that I treated when the center opened was a young woman. She was in her early 30s. She had had 5 miscarriages. She had already gone to 3 other fertility clinics, had a pile of records 1.5 inches thick, had been tested for all kinds of rare, unusual genetic and clotting disorders, and in the end, always been told, you just have bad luck and you should do IVF. She came to our center. She had already been charting her cycle using the Creighton model system. We opened her chart, and there on her $5 chart was the answer for why she was miscarrying. There's a very important hormone that's made after the woman ovulates that plays a critical role in sustaining a woman's pregnancy. And the pattern that says this hormone is low was right there in her chart. So we replaced the hormone that was missing within just a few cycles she conceived. Her baby's now 1.5 years old, was actually our first baby born through the center, and she has a second baby due any day. The Creighton model system is really a system of maintaining a woman's reproductive health, so we encourage women to come for their annual GYN checkup, and we use that visit to educate them about these very things. So the best way to manage and maintain gynecologic and reproductive health is to understand what's going on in your body and learn as early as possible how to take care of that. If you're looking for an alternative to the birth control pill, if you're looking for a more natural approach to managing your health or spacing children, avoiding pregnancy, achieving pregnancy, it's something that's worth looking into. Once you understand what's going on inside of your body, that's yours forever, and you'll be able to use it to help your doctors take care of you.